Dr. Jordin Wiggins, welcome to the Confessions of a Next Therapist podcast.
Thank you. I'm so excited to be here.
Yeah, I'm so excited. I think this conversation is going to be so useful for my audience. I think that you're going to bring so much wisdom and so much insight. So I always like to just sort of dive in and really give the audience understanding of who you are, what you do. And really for me, I think the most important piece of who you are and what you do is how do you understand your own personal mission in terms of what you bring to the world?
This is so good. I love to start my Monday morning talking about sex. So basically, I believe that lack of pleasure is a health problem. And almost 1 in 2 women experiences sexual dysfunction at some point in their life, and they don't have anywhere to go for answers. So that's where I come in. That's where my mission is, to change the way we discuss and communicate, educate, and deliver sexual health and wellness for women.
I love that. I love it. And what I'd love to, I mean, I've written something down that I want to circle back to, but what I'd love to know, Jordin, is how did you land here, right? I'm always so fascinated by sort of the journey that brings us to where we're at today. And that's something that we discuss often on this podcast is as women, like how do we find that calling? How do we really like tap into that mission and have the courage to lean into those pieces of our lives?
Well, this took a lot of courage. You should see my DMs on the daily from just the nature of what I talk about and men asking me for sex, and if I have like whatever offering to pay me. It's crazy. So my point
I can
being,
imagine. Yeah.
I did not intend to have sexual health as my career because there was so many evolutions that needed to take place for me to feel confident enough and be able to write a book about it, because there is just you're this target when that's what you talk about, and people just think that I have sex all day, and that is like not at all what my mission is about. So I had to go through losing my libido now 3 times. I talk about it twice in my book. Once I was struggling with depression in my pre-med degree and just completely lost touch with my libido, my joy, who I was. I would fake smile, just barely holding it together. And the journey back from that, which actually turned out to be more hormonal imbalance related, but figuring that all out, going to naturopathic medical school, and I was sort of like, okay, I'm good again. And then I started to have pelvic floor pain after an operation on my vagina. So we'll just be very, very clear. It's
Right.
called a Bartholin cyst, and it's a very common surgery for women in their early 20s or like reproductive years that, again, we don't talk about because we're ashamed. So after that surgery, I had pelvic floor pain, lost my libido again because sex was painful, and needed to find a way to get that back. Fast forward to today, I'm 4 months postpartum, have a little baby girl at home that you might hear during this recording.
Which would be totally okay for this audience.
And so here I was again, but this time I had my tools and my framework to kind of find my way back, because we know that the hormones and the sense of feeling very alone
Right.
postpartum is really overwhelming, and again something that we don't love to talk about and love to share so much. But basically those 3 big events where my healthcare providers didn't have answers for me, friends didn't really have answers, so I was left to my own devices for the last 15 years to read and go to school and kind of compile all of this stuff into something that actually works for women that want sex.
Right. I love how you put that, right? Women who want sex. And I want to circle back to the stat that you shared right in the beginning. So when you say 1 in 2 women experience sexual dysfunction, um, h- how do you identify what is sexual dysfunction in women? Like, what are the parameters for that?
So that is, first of all, I want to make a point of, if we can just think about how huge this is and think about how much traction COVID has gotten.
Yeah.
And that is a fraction. Like, there are billions more women that suffer from sexual dysfunction, and we don't talk about this. This
Right.
isn't known. And I'm not saying that sexual dysfunction is deadly, potentially. That's not my point. My point
Yeah.
is just, it's affecting billions more women, and it does have health implications, but it's not talked about. So this is a
Right.
huge thing that I don't think, the weight of it needs to sink in. And sexual dysfunction is women that don't have desire for sex. And this is huge. That's the
Mhm.
biggest thing. They want to want it, but they don't.
So they
They,
want to want it, but they don't want it. And it's interesting to me because, as a former couples therapist, what I'm used to assessing is desire for emotional intimacy, right? And that's one of our factors that we look at when we work with couples is you might not want that emotional intimacy right now, but you want it because that's what points to desire. So it's very interesting, Jordin, that it's a sort of similar assessment tool that you're using when it comes to sexual health.
yeah, and that's where our work is very aligned, because if we lose that emotional connection, that's a big part of my work to get it back for libido. Like, they might come to me because of libido, but if that emotional connection is gone, that's something that needs to be repaired, as well as, the hormones and the communication and all the other pieces. But it's very fascinating. And sometimes I think women will say to me, well, what's normal?
Mm,
Like, once a week, twice a week, like,
right.
what should I be,
Yes.
putting on my to-do list to get
Yes.
done? And it's like, first of all, if that's how you're approaching intimacy, that's the wrong way to look at it.
But isn't that so common? Because I get that
Mhm.
question too, right? Like, well, how often should we be having sex? Like, when is it actually a problem? Or right, like when should I really be concerned? But I think it's so ingrained in us that we think of it like this, I don't know, this thing that we've got to check off a to-do list of I've got to do it X number of times to have a healthy relationship.
Exactly. And really, it's a problem if both people in the relationship aren't satisfied. And people could have, and I love to hit home the point that it's not about the number of times, it's about the quality, because people could have an intimate connection, or in we can talk about this, but we like to make sure that the focus is not on penetrative sex. But what people are really seeking is to feel connected, and to feel connected physically in a way that bodies can speak that sometimes words can't. But they
Right.
want to feel desired and alive and all these other things. So you can, if sex is on your to-do list and you're just trying to get it done, you're faking enjoyment, that it's not fulfilling. It's not fulfilling for you, and it's really not fulfilling for your partner either. But one fulfilling encounter a month might be enough for some
Right.
couples. It just depends on the couple.
And I think that's so important for women and for couples to hear, right? That even just hearing you say, as someone who has so much expertise in this field, that one fulfilling encounter a month might be okay for you. Like that might be enough. That might be what is satisfying in your relationship, right? That it's not about this cookie cutter approach to what a sexually thriving relationship actually looks like.
And it's how to stay connected between.
Right, right. Say more about that because I think that's so important.
So we have this focus on P in sorry, I'm going to get this out of my throat so that I'm not going to
We'll
have
just edit
this.
that
Yeah,
out,
edit
Andrew.
that out.
Just take that out.
Yes, please, Andrew. Sorry, don't make me cough in everyone's ear. we have this focus on penetrative sex. And this is where we are all missing the mark. That if it's not P and V, it doesn't count. It wasn't sex. So ways to stay connected in between might be, and I know you probably talk about love languages a lot, and I think
go there. Let's talk about it.
Reading should be a love language, and reading naked is my favorite love language.
Right.
But something like that, where phones are away, you're focusing, either physical contact, or maybe you're not reading, maybe you're just eye gazing. And this is something that we're challenging couples to do often, because have you ever sat and looked in your partner's eyes for 20 minutes? You don't speak, you don't touch, you just look at each other.
Is there a name for this? Is there a name for this sort of, I don't know what to call it, intimacy, foreplay, like?
So we call it play, and that's in the Pink Canary in my book. This is a big thing that we want to hit home for people, is just foreplay makes it sound like it's something that comes before the main event. And again, that's putting focus on penetration. And if all we think that we want is, a little kissing, some foreplay, and something ending with penetration and mutual orgasm, that's like going to a restaurant and ordering the same thing off the menu every single time. You're going to get bored and you're going to stop desiring that item, which is what we see happens with sex. So when we focus on play and other types of intimacy, like eye gazing, maybe it's going for a walk, holding hands, but some type of physical or emotional connection that strengthens a relationship and really rebuilds the connection and turns on the desire over time.
I love this. I love this reframe. It's such a subtle reframe, but it's, I think, such a critical reframe, right? From foreplay to just play, right? That feels so much more expansive. It feels so much more accessible. It feels so much more fluid within a relationship system. And I really, really love that concept. Can you help for our audiences listening, for the women that are listening, and for those women that may want to take some of these concepts into their relationships? What's a simple way to just add more play? I love your eye gazing example. Are there some other simple ways that women can just begin to play a little bit more with? I love the words that you're using: desire, satisfaction. I just think that those are much more accessible ways to think about sexual health than the language we have traditionally been given.
Thank you. It's exciting, and it's a way to kind of enroll your partner and start working on things for yourself, because I work primarily with women because they are, we call it crusty, so unfulfilled, so out of touch with their desires because they're so used to overworking, caring for others. And then what they want and need is so muted or so silenced because they're so busy that they don't get to it. And if it was on the to-do list, it gets crossed off in favor of something else more important for someone else. So we often, because the relationships are so fractured, the not even knowing what you want, we're starting with small things like, how do we bring pleasure into your daily life? What podcast can you listen to on the way to work? Hopefully this one that's going to make your drive a little better. Having fresh flowers for yourself on your kitchen counter, taking time to bath, do yoga, whatever, but just little doses of things that are going to increase dopamine, oxytocin. You're going to feel good. So anything that you can do for yourself to feel good is going to feel good for
And
your
and I
relationship.
believe that so wholeheartedly, right? Like I so believe on such a deep level for women, turn on, desire, like satisfaction sexually all starts like it starts way before the bedroom, right? And it really starts, I think, with ourselves and truly how we're treating ourselves. But can you sort of unpack that a bit for our audience, Jordin? Can you help the women that are listening to really understand this connection between how we take care of ourselves, how we treat ourselves, how we even think about ourselves? I know you talk often about pleasure mindset, right? How that whole real practice of self care, how that can actually translate into feeling more sexually fulfilled.
So these are principles that I took from Chinese medicine, where if we can think of it like a cup, and if we have an empty cup, because every day we're over giving, over scheduling, and we're empty, we're crusty, like we call it, then we come at things from a place of need, and we might be angry or snippy. We might be very, very tearful or needy. And these things are all valid emotions. I don't want to say don't feel the way that you're
Right.
feeling, because things have gone on to get you to that place in your relationship or in your life, and that is completely okay. But when we start caring for ourselves and start filling up that cup, we're in a place of abundance and overflow. So when we ask for something, we're commanding instead of demanding. And it just completely changes a whole relationship dynamic when you're satisfied with yourself, when you have extra energy, and you're not snippy or crying. And these are exaggerations, but I'm sure we can all identify with those things at times. Me last night, overtired from breastfeeding and just like lashed out. And really, it's never about the issue that we lash out about. It's for that deeper looking for connection. So it wasn't about taking out the garbage last night.
Right.
It was really about like, I'm overwhelmed and I need a hug right now.
Mm.
So, but just even being able to figure out what we want and then be able to ask for it, it puts your relationship in this just completely new stratosphere of
Absolutely. Yeah.
where we're constantly filling up each other's cups instead of, snipping, ignoring, avoiding.
Yeah, I love that. I love that. I think that often, if you're a woman and you're listening and you're hearing these concepts for the first time, I know for me, even when I've sort of put that together in my own life, right, that how I feel about myself, my ability to access feelings of desire and satisfaction really do go back to what I'm giving myself, right? How I'm seeing myself, my own mindset, my own ability to take responsibility for my happiness, all of those pieces. I think when those concepts are new and fresh, it's really difficult to see that connection. Like it's difficult to see how our sexuality, our pleasure, our sexual, how all of those pieces are actually connected way back to these what can seem like really small acts of self care, right? And self respect and self worth and all of those sorts of things. And it's not just about the bubble baths and the, like pedicures and things like that. Those are amazing. But real self care, I think, comes down to giving ourselves the space and the capacity to be able to identify what we need and then ask for it.
Literally what we're teaching women every single day. And we get so disconnected from the desire, from what we want.
Yeah.
And I noticed this in my naturopathic practice years ago. And I'd say to women, what do you desire
Mm,
right now? What would make you happy? And two things would happen. They'd look at me with a blank stare
mm.
or tears, just a
Right.
complete breakdown.
Yeah. Can I
And
ask, what do you think the tears were about? Like the blank stare, I kind of get, right? Because
because it's
I
like,
think
no one's asking me this.
nobody's ever asked. I've never had to think about it. Right. But what do you think the tears were about?
Feeling so disconnected from the desire, from what you want and need, that it's painful
Hmm.
to feel that alone and that disconnected, because they don't even know where to start. It's just so overwhelming that they don't know where to start.
Mm-hmm. And this is one of the things that I've heard you talk about. So for my audience, I've been, following Dr. Jordin's work. I have a lot of respect for what she does. I really think she delivers um, sexual education in a very, very unique way, in a way that I truly haven't seen in this particular niche and in her space. And so she certainly is my go-to person for this type of information and education. And one of the things I hear you often talking about, Jordin, is stress and overwhelm, right? And the impact that stress and overwhelm have. And I wonder if that's kind of what you're touching on, when I ask you the question, like, what are those tears about? Right. It's not being able to actually move past some of those day-to-day stressors and even tap into those deep desires.
Exactly, because we've been to a place, you and I both probably have been here, where we can't even figure out what we want for dinner.
Yep.
Like, we're that
Totally.
overwhelmed
100% have been there. Yep.
that it's like, if even just thinking, what am I going to make for dinner is overwhelming.
Right.
And that's when our stress response is taken over, and we're so in a sympathetic nervous system state, which when we're there, we don't find anything pleasurable. And they've done studies like MRIs of people's brains. And when they are stressed and overwhelmed, the pleasure centers are turned off.
Wow.
They're not as active as when we're in the
Mm.
parasympathetic nervous system state. So, given that we all live life
Hmm.
for the most part, other than those unicorns out there that have really learned the balance and to go slow, but being stressed in the sympathetic state literally turns off desire. And that's why I think we have such a epidemic of low libido in women.
Right. And I would say probably that the community of women you work with is similar to the community of women that I work with. We both tend to work with high performing, high achieving, type A go-getter type of women, and I certainly see it, right? For like in the work that I do, I always say that the high performing women in particular have a harder time building emotional intimacy in their relationships because we're so used to being self-sufficient, right? And I imagine that that translates into the work that you do as well.
It does completely. And we do have the exact same type of women that we work with. Like, they're doctors, lawyers, CEOs, and like mom bosses that really
Mhm.
handle things. And for when we see specifically to do with sex, it's this really neat balance between the masculine and the feminine. And
Mm,
we're talking energies, and a more Chinese medicine type of yin and yang and that balance. And these overachieving women,
mm,
they get things done. They're not great at asking for help. They tolerate a lot, and they'd really rather take things on than, yeah, ask for help. Or when
right.
it comes to sex, they have trouble receiving
Mm,
pleasure
mm,
and feeling worthy to
right.
receive pleasure. So there's a whole, that's, well, two modules of my program and a couple chapters of my book,
Right.
because we need to learn that.
Right. 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 Yeah. And I think, I would agree. Like, I think it's a very, we experience it very differently when you are used to being go, go, go all the time, as you say, right? Like, you almost get, I know for me, like, there are moments in my life where I just get so used to like executing under stress and pressure that when the pressure is off, I'm like, I actually don't know what to do. Like, it's just too quiet. You and I have had this conversation. I'm like,
Yes.
I don't know what to do when there's no like deadline and there's no pressure and there aren't like five projects on the go.
Yeah. How do you
Right.
just be? And how do you find fulfillment in being? Because a lot of times we're attached to the outcomes and the
Mhm.
achieving.
Mhm.
And just physiologically, when we're in that state, our bodies can't receive pleasure optimally. Touch doesn't feel as pleasurable. If your
Right.
partner says something sweet or does something sweet, we're just literally not
Yep.
rating it
I have been there.
as, yeah, we're not rating it as pleasurably, or we're not as grateful.
Right. We're
Um,
probably not even taking it in. Like I can
no,
speak for myself. I'm like, it doesn't even land. Right. Because
yeah,
I'm just like, what's next on the to do list? Thank you very much. Let's
exactly.
just carry on.
Yeah, because we're in that mode.
Yes.
So a lot of my work, and because people like they want more pleasurable sex, they want it, they want to have better orgasms.
Mm.
And when we're in that state, that go, 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 that's not the state that you need to be in. So the learning is being able to flip between your masculine and your feminine.
Yeah.
And when you can do that efficiently, that's when your whole life changes, not just your sex.
I'm smiling. Jordan and I are recording this on video. I'm smiling because you know what it makes me think of? It makes me think about with parenting, how we talk about the importance of transitions for children, right? Like when they go from one space to the next, we need to actually like build in an actual transition to say, okay, you're going from here to there, and these two spaces are different, right? It sort of makes me think, Jordan, that we as high achieving, high performing type A women, we also need transitions. We need transitions from our professional self to our personal, private self, if you
So
will.
yeah, and I will tell you two things. One, we work on transitions in Pleasure Principles, which is my program for
Right.
women. And two, this is something that I am currently struggling with in my own relationship and life, because I'm at a bit of a transition in
Mm.
my career and everything. And I have a partner that is supporting me and saying, do what you need to do. It's going to be fine. I
Right.
will support you financially.
Uh-huh.
We're working on the emotional support part.
Right.
But I will support you.
Mm-hmm.
Follow your heart.
Mm-hmm.
And I'm going, I can do this by myself.
Right. Right.
And I'm not able to receive.
Yes. Right. Like it's just not landing. Like that's the image I keep getting, right? Like it's just it's not landing anywhere.
Right.
And it needs to land in order to sort of take root and for you to then take that next step.
Exactly. And if I know in my heart that if I can be still and do what I need to do and show up how I need to show up, that my life and everyone connected to me's life is going to be so much better. I know that in my heart. And then I get in my
Right.
head and think, what if this? What about that? And
Right.
then want to try and play it safe or do it all
Mm-hmm.
myself,
Mm-hmm.
worry about what other people think,
Right.
which is, that thinking has served me well to get me to a point, because I have had a lot of career success and everything, but I know that my next level comes
Mm.
from being in my feminine, but it's not
That's,
easy.
yeah, it's so interesting. It's such an interest. Like we had questions and things like that. I think we kind of weave them into the conversation, but it's such an interesting place for us to sort of land with this conversation because it takes me back to where we started, which was the checklist. Like, is sex just another item on that checklist? Which, if we view it that way, that totally fits with like that high performing, high achieving, goal setting, right? It's all about the outcomes and the results type of woman. But if you're inviting us into the space, right, where it's more about receiving, it's about slowing down, right? And really tapping into our feminine, you're calling us to tap into something that we don't often tap into on our day to day.
Exactly. And that's the work, to
That's the
be
work.
slow and receive. And that's where the connection is. That's where the, sparks fly. And that's where you can constantly be on a journey
Mm.
with your partner, discovering things that are pleasurable and enjoyable together. So there's no more ruts. There's no more disconnection. It's just one fun experiment after another.
That's amazing. I love that. I love that way of thinking about it. I love that you've, um, I don't know how to say this, but it's like you've given us this perspective on desire, on sexuality, on satisfaction, that's actually really accessible. Like I just find I find your work so accessible for the everyday, like go getter, high performing type of woman, which I really love because I think it's not often a way that we talk about sex.
It isn't, and it should be,
Mhm.
because we need a reframe. We need what we call in Pleasure Principles a sexual health re-education, because the model that we were taught, the checking off the to-do list, the performing, just getting it done because you're on to the next thing, that doesn't work. And you don't want sex and intimacy when you're in that state. So it's I love what I do. I love the women that I get to work with every single day. And the best part about it is when when we have these conversations, these women then turn around and they teach their children. So
Oh,
we're
that's amazing.
changing things for the next
Mhm.
generation. They're
Mhm.
getting pleasure centered sex education. They're getting consent conversations. And I think really that's how we're going to reverse the problem of
I
one
love
in
it.
two women suffering from sexual dysfunction.
I love it. Love it. Love it. Love it. Jordin, I know that my audience is going to listen to this episode and they're going to want to go and find you in all of the places. I remember if you guys are inside my Facebook group, the EQ Lab, somewhat recently, a few weeks ago. I don't know if you remember this. I tagged you in a post
Yes.
related to a conversation that I had with my 11-year-old daughter, which is exactly what you're talking about. She had asked me a question about vaginas. Right? She was like,
Love
why
it.
do vaginas look right? Like, why does my vagina look different from your vagina? Like it was just like this, question that she had. And it was when I was tucking her into bed and we were saying good night. And of course, that's when all the good questions come out. And so I grabbed my phone and I was able to go to your Instagram account and trust that the information that you were going to be sharing would be sound and educational and supportive. And I was actually able to share it with my 11-year-old daughter. And I don't know if you remember the picture, but I knew I had
I
seen it.
do.
I scrolled through and it showcased beautifully and tastefully in just such a amazing way. Like I can't say enough about it, but it was such a beautiful way of showing how women's bodies are different, including our vaginas. And I could actually go to that picture on social media and show her. She was all like, "Oh my God, mom, where are you? Like, what is this?" Right. She totally had that reaction. And I was like, "This is my friend Jordin. And she teaches women about their bodies and about their sexuality. And she's a sexual health educator." She's like, "And she's doing this on social media." And I was like, "Yes, she is."
That's
This was the
amazing.
conversation we had. I was like, "Yes, she is." And social media can be used in this way, right? In a really empowering way. And we looked at that picture together and we talked about, the different images that you had on there. And it was so educational for her. Like it really opened her eyes at 11 years old. Right. So I just want to, yeah, I
Thank
absolutely
you.
want to say, yeah.
Yeah, because that's exactly what I'm talking about and the change that I would like to see in the world, and where your daughter can grow up and not feel self-conscious about her vulva because we have,
Yes.
you know, pornography and
Yes.
images and textbooks that are devoid of color and texture and reality. And
That's right.
so she can feel confident about
Hmm.
herself.
Hmm. Yes. I love it. Yeah. I can't say enough. So please tell my audience, where can they go to find you?
I'm most active on Instagram at Dr. Jordin Wiggins. Send me a DM. I promise I'll get back to you. And my favorite place is the Pleasure Mindset Bootcamp. It's my free online community on Facebook. I would love it if you could all join us there. We have a free event a live event coming up April 12th. So if any of this interests you, I would encourage you to join us. The conversations are always amazing. And hopefully we can help some of you stop looking at sex as another to-do list item.
Absolutely. Dr. Jordin Wiggins, thank you so much.
Thank you so much for having me.